products of the horse industry. And now, Horse Talk Live.
Hey everybody, thanks for coming to join us for another episode of Horse Talk Live on Rural TV. I'm Lizzie Iwersen, and we have a great guest today, Dr. Meghan Wintermyer, who is an acupuncture expert as well as a veterinarian. So we're going to really get to spend a lot of time learning what acupuncture is when it comes to helping you and your horses. It's great that we have this full hour because there's a lot that goes into acupuncture. And for someone like me that didn't know much about it, we definitely have a great guest and expert to shed some light. So Dr. Wintermyer, thanks so much for being here.
Well, I am happy to be here. I love talking about acupuncture.
Great, because that's what we're going to do. And we've got a full hour to do it. You've got some video that you brought along with you to show people how you are treating horses. Yes. And, well, let's find out, first of all, about you. You're a veterinarian, and then you decided you wanted to enhance your veterinarian practices with acupuncture?
So first I'll tell you how I became interested in acupuncture. I went to the Ohio State University veterinary school. Then I moved to Texas to practice, and at that practice there was a veterinarian who exclusively did acupuncture and chiropractic, and I was a huge skeptic. And I watched him work on cases, and I said, oh, how neat, what a neat coincidence. And then I watched him work on another case, and I said, oh, how neat, what a neat coincidence. And then I was working in the ICU, and there was a horse, and I can't tell you for what reason, but he could not urinate. And I'm not kidding, Dr. James Simpson, hooked up the acupuncture needles, hooked up the electroacupuncture unit, and the horse started to urinate for the first time. And I thought, maybe there really is something to this acupuncture thing. And the second thing was I suffered from chronic headaches, and I was told where to stick the acupuncture needles. And I'm not joking, I put the acupuncture needle in, and my headache went away instantly. So that's how I first became introduced and interested in acupuncture.
Okay.
So then I decided to go to the renowned Chi Institute in Reddick, Florida, where I learned from Dr. Shea, who teaches traditional Chinese veterinary medicine, not just acupuncture.
Okay. And was everybody there with you? Are they all veterinarians? Or
You have to be a licensed veterinarian. And the interesting thing is not everyone's from the United States. People from around the world travel to the Chi Institute to learn acupuncture from Dr. Shea.
Okay. So you were already a practicing vet and then decided to go to school.
Correct.
How long is the school? What was your curriculum like?
The school is 7 months. It is pretty rigorous because you are a veterinarian. You're practicing every day. They expect you to study the Chinese physiology, learn the diagnostic points, learn all of the acupuncture points. There's online modules and there are on-site classes.
Okay.
So
nowadays, you SilverLeaf Equine Services is your practice.
Yes, I founded SilverLeaf Equine Services. My husband's family is in Tennessee, so we relocated.
Okay.
And so I'm in Central Tennessee, and I started my own practice. And I have probably 80% caseload is acupuncture. And I also do traditional veterinary work where it's hoof abscesses and laminitis and castrations and dentals, but my main focus is acupuncture.
Okay, so if somebody in our area, in the Middle Tennessee area, needed a vet and also maybe interested in acupuncture, then they've got both.
And that does happen. I've been called out for a laminated case, and I scan all of my horses regardless. And while I was there, the owner said, I have another horse I want you to look at. So the laminated case I treated conventionally, but then she had a horse that had severe soft tissue hip problems, and I treated with acupuncture that day. So you never know how your day's going to go.
So what typically are some issues or reasons that a person would call you to perform acupuncture on their horse?
The easiest cases to treat with acupuncture are the musculoskeletal, for example, tendon ligament problems, back soreness, soft tissue hip problems, hock problems, stifle hop problems. The horses that they've had their stifles and their hocks injected, and 2 weeks later the horses are better, but they still have 20% back are off.
Okay.
Chronic heel pain, navicular pain.
And then what about this case that we see up here? This is a good before and after.
Okay, so this case, this poor owner has suffered, this is lymphedema. This horse was treated by the top veterinarians in the area for on and off for 3 years and had negative biopsy results, was on steroids, antibiotics, hydrotherapy, walking, and nothing was helping this horse. This horse was depressed, he was not eating. 24-year-old thoroughbred off the track. The owner cared very much for him and just wanted him to feel better and his leg to go down. And I went out there, I did the traditional Chinese veterinary medical exam and did one acupuncture session with no herbs, and 1 week later we have an image of him, and his leg was reduced in size, I would say, by half.
Holy cow. So that was just after...
So that's just one treatment. And like I said, this horse, this is an older horse. He had multiple problems, so I did end up treating this horse for 5 weeks on nearly a weekly basis. And after his acupuncture treatments, he was eating, he was walking and running his pasture, rolling around, happy. The owner was very pleased with the results.
So typically, is it one treatment, multiple treatments?
And it's really hard. Everyone hates this, but the answer is always it depends. Okay. It depends on what's going on with the animal.
And typically, when instantly, do you see a little bit of a result, or does it take a while?
It can take 24 to 72 hours. There are really neat instances where a horse can have chronic back pain, and I can stick an acupuncture needle in its hind foot or near its eye, and the back pain will go away instantly. But typically, the results are within 72 hours. You can see changes. But on the typical case, I say give me 3 treatments before we give up.
Oh, okay.
So,
all right. Well, we have some photos that we're going to play while we're talking here to show people what acupuncture looks like when it comes to treating a horse.
Okay.
And this is something that you obviously have spent a lot of time perfecting. It's something we want to make sure people don't go home and just stick needles in their horses.
Yes, absolutely.
But I mean, the images that we see here, there's a few different types of acupuncture we're going to look at.
Yeah, so there are 4 main types. There's electroacupuncture. That's an example of dry needle acupuncture.
And all of the sites, the needle sites, are specific. You're not just guessing here.
You are absolutely not guessing. If you're guessing, you're probably... It's close puncture, not acupuncture, which might be effective in a placebo effect. There are also trigger point therapies, which is called ashi points. So horses that if you press on a spot and they are sensitive, it's not actually an acupuncture point, but they're called ashi points, and they are you can treat them for those trigger points.
So a lot of time, we hear a lot of human medicine using acupuncture. How long has acupuncture been used on animals or horses?
It's been documented for 3,000 years, but 650 BC, there's a gentleman who was working on the emperor's horses, and basically the Chinese progressed over time. They didn't believe in dissecting the horses, or humans. So they would find a spot on the animal or the horse, and they would see how it affected the body, and they would write it down, and from there would use it as a treatment point.
Okay. Ultimately to relieve pain.
Ultimately to relieve pain and to treat certain conditions.
Okay.
Yes.
So in relieving pain, are most of your clients using or use their horses for competition, and that's why they choose acupuncture to relieve that pain so their horse can perform better? Or
there's a wide spectrum of people using this. barrel horses who are nervous before they get to the gate, acupuncture might be good for behavior.
Okay.
They also might have the hind end pain because they are asked to move so much off their hind end. So acupuncture could be used for a combination for those horses. The dressage horses, the high-end horses who are testing and cannot use any performance or NSAIDs, acupuncture is the only pain relief that they can get. The backyard owner who really loves their animal and just doesn't want them to be in pain, those are owners who are using it. Performance horses who have tried everything else.
Okay.
Those are wonderful cases for the TCVM therapy, acupuncture and herbal therapy, because Western or conventional medicine, they've done and exhausted everything they can, so now they're going to acupuncture.
Okay, so it can be used in conjunction a lot of times with traditional or conventional
Absolutely.
medicine.
Absolutely.
Okay, well, we're going to take a quick break. When we come back, we're going to get a little bit further in depth and show you Dr. Wintermyer working on a horse, and she'll walk us through it, tell us what we're seeing there, and ultimately find out how it can relieve pain, help some behavioral issues, things like that in a variety of horses. So stick around. We'll be back with more on Horse Talk Live.